Oh, now she back.
Okay. As you can tell, we're having a very bad storm where I live.
Oh, okay.
I have high winds and heavy rain right now. Just started. So if I lose you again, just do what you did. Stay on. Thank you. Okay. All right. All right. So we're gonna pick up where we left off. If I lose you again,
Stay on.
Yeah, it's really bad. Hold on. Let me see what my screen, what happened. Oh, what happened to my, hold on. Alrighty, gotta stop my screening. Okay, well, I can't bring up my PowerPoints anymore. So I'm just gonna wing it. Okay. All right, so where were we? We were up to the reflexes, right? Okay.
Mm-hmm.
All right, can you hear me okay? Because it's really pouring. All right.
Yep.
Can you hear me okay?
Yes,
okay.
ma'am.
Okay, good. Thanks. I need some feedback because all I'm hearing is pouring down rain coming in. All right. So we talked about reflexes. So what I want you to get out of it is the ones that can keep the baby infants alive. Like I said, blinking, the sneezing, the gagging, the sucking, and the grasping. Okay. Now there's some other reflexes. It's called the Moro reflex. And that's the startle reflex, where you maybe hit a baby, you know, the crib, and the baby gets jilted a little bit, and the baby goes up like this. His hands are like in the shape of like a C, and it's called the Moro reflex. That's a startle reflex. That's a good reflex, right? Because that could help save them too. The one I really want you to write down is called the Babinski reflex. How do you elicitate Babinski reflex on a newborn?
Stroking of the sole of the feet.
Yes, good. Did everybody hear him?
Yes.
Right. Okay, write that down because that's an important reflex, so you'll see that one again.
Can you repeat that again?
All righty. So let me go on here.
Stroking of the sole of the feet.
Yeah, you just, the sole of the feet, the foot. You just, and what happens is when you do that, his little feet they fan out. See, they just fan out. Yeah. Okay. All righty. I'm gonna let y'all know I'm in the dark here. All right, how do you use a bulb syringe on a baby?
Bulb syringe on the side.
In the mouth first, and then the nose.
Okay, mouth
side of the mouth.
Okay. All right. So I want to make sure my baby always has a patent airway. So, right? Yeah. So correct positioning on his back or his side. And then you remove the mucus from the mouth and the nose with a bulb syringe. Okay. Now, when you put that bulb syringe in, how do you put that in?
On the side.
On the side. Everybody hear that? Write that down. On the side. You don't go through the middle of the mouth, because when you do that, that's when you can elicitate that gag reflex. And you don't want to do that, because if he has a lot of mucus and you're trying to give him a patent airway, you don't want him to aspirate on his own mucus. And he could by gagging. So I go on the side of the mouth and I'm going to squeeze my bulb syringe and get in there, and you suck it right out. Okay, good. All right. And there's a great picture in your book too with that. All right. Okay, let's go on. All right. What's an APGAR score and why do we do it?
To test what you have to do for the baby.
Check out the baby ease.
So Dr. Virginia APGAR came up with this APGAR score. And what is the purpose of it is to know what level of resuscitation the nurse needs to do. Okay? Do I need to do full efforts? If the baby have a 0 to 3 APGAR, you better, okay, because the baby's in trouble. If the baby has an APGAR 7, an 8, 9, 10, I may do some gentle simulation, right? Just because I have to dry this baby off, and by drying the baby off, you actually stimulate the baby, okay? So we're looking at respirations, we're looking at heart rate, we look at muscle tone, we look at reflexes. You know the reflexes we just did? Okay, and the color, all right? And so we do an APGAR at 1 minute and 5 minutes of age. Okay. All right. Now, if a baby has sternal retraction, is that a good sign or a bad sign?
Very bad sign.
Bad.
Very bad sign. Very bad. Yes. Would you report that to the healthcare provider, to the doctor?
Right away.
Right away. Patrick's. Hi, Patrick.
Yes, I was in class.
Good to see you. I know that's good. Don't worry. We had a little power outage up where I'm at, so you never no problem.
Oh, okay. That's mean I am on time.
Okay, yeah. But you came on a good time. Sternal retractions. Okay.
All right.
We gotta report those. And you know, I'm looking at his color. Now, if a baby has hands that are blue, hands and feet are blue, what's that called?
Normal.
Acrocyanosis.
Acrocyanosis, right. Is acrocyanosis okay?
Yes.
Yes.
For how long?
How long?
It's like a couple.
Like
Until
24 to 48 hours. And that's okay for 24 or 48 hours. And then what happens after that? Then baby is still cyanotic, you got a problem, right? But maybe there'll be a question about that, where the daddy's asking the nurse, I'm so worried about my baby. Okay, and the nurse knows that the baby was just born and the baby has hands and feet that are blue. What would you tell the dad?
That's a normal sign.
Is it
Yes.
common?
There's normal sign. Good. Okay. All right, let's move on. What's the normal temperature for a baby?
92 to 95.
97 to 100?
Yeah, 97.1 to what?
100
99.
or 99.99.6 or something.
Yeah, 0.6, 0.8, whatever book you're reading. Yeah. Okay. What about the pulse?
92 to 95.
110 to 160, right?
Oh, pulse. Pulse.
Yeah,
Yeah.
like remember during the fetal monitoring, 110 to 160. How about
That's right, yeah.
respirations?
30 to
30
60?
above 92.
60, 30 to 60.
Yeah, 30 to 60. Yeah, good. Okay. And if the baby's making like a grunting noise, is that good?
No.
No.
No, that's called noisy respirations, right? He's grunting.
Mhm.
That means he's got too much fluid. He doesn't have a patent airway. What about nasal flaring? Is that a good one?
No.
No, that's another sign. Nasal flaring and
Oh, you got it.
contractions. Good. Okay. There's always questions, guys, on that. Always. All right. What about, let's see, let's go on here. Let's talk about the skin. What about his skin turgor and the overall condition of a baby's skin? If he's covered with all these fine little hairs, what's that called?
Lanugo.
Lanugo. Okay, all right. What about the Nature's Cold Cream? What is that called?
The crazy something.
Vernix.
Yeah, Vernex Casio.
Vernix.
Okay.
Casio.
What about Mongolian spots?
That's the bluish color.
Right. And that's common, right?
Yeah.
Okay, now, does that, let me say. The mother is very concerned about her baby's Mongolian spots. let me get a question. Oh dear. Okay, hold on. Stay there. Oh boy. Okay,
Please,
I'm back.
please check the PowerPoint.
I'm back. Hold on just a minute. Let me find you a question on that so I can help you a little bit.
Give it to us.
I may lose power again, guys, and I really am very sorry, but we're in a very bad storm here as I talk to you. Let's see. Oh, I got another question too. Let's see here. Okay, so the nurse, she's trying to teach the mother about mother who is leaving the hospital. She's discharge planning. Okay. And she's talking about the Mongolian spots. And the mother, the patient, the mother of the child is quite concerned. And so she says, I will ask, I don't like these spots on my child. So I will ask my doctor for a cream to remove the discolored spots on my baby's bottom. Did I do good postpartum teaching with this patient?
No.
No. Because it's gonna go away.
Gonna fade away.
So what would you do then?
Just teach
The
the mark.
Give them information.
Yeah, give her some more information about that, right? Because she thinks that the spots will go away, right? If I put some cream on it. So that means that my discharge teaching wasn't so good, correct?
Yeah.
Correct.
Okay, good. All right. Now those kind of questions they like to ask you, like the nurse knows that future or further teaching is necessary because, and then they give you a choice. Read those kind of questions carefully, okay? Sometimes you have to go back and you have to reword it for yourself in order to catch on. Okay. All righty. What is necessary for the absorption of oxygen? What does a baby need to be able to absorb oxygen? What's that?
Surfactant.
Surfactant, right. Patrick knew that too. I know because he asked me that question a couple times, right?
That's right.
Yeah, surfactant. Write that down. You need surfactant. And that's why we give, what medication do we give mom prior to delivery on a preemie? I mean, prior to delivery of a preemie, what do we give mom? What medication?
Betamethasone.
Yes, betamethasone, good. And it's two injections, 24 hours apart. And we give that to increase the surfactant level, all right? Because surfactant is starts developing in the fetal development time. Okay, good. Okay.
Professor,
Yeah.
so what if the newborn received too much oxygen?
Well, we can talk about that. What condition can we cause?
Toxic.
What's that called, everybody?
Hyper.
That's that bronchial pulmonary dysplasia.
Or
Too
dysplasia.
much oxygen.
Can
We
you
over oxygenate. That's why we use a pulse oximeter and we put that on what? The baby's foot, right?
For the boss? Oh, I thought you were talking to me.
And you put on the baby's foot in order that we know how much, right? What's a normal, okay, since we're here, what's a normal level of oxygen for the baby?
92%?
92%. Did you all hear that? If you don't know that, write that one down right now.
No, Professor, can you go over, please?
Sure. So remember, we talked about surfactant. We talk about getting the baby enough oxygen, right?
Oxygen, yes.
But we don't want to over-oxygenate these babies because we can cause more problems. One, we can damage the retina of the eye. And number two, we can cause bronchial pulmonary dysplasia. So we don't want that. So we're going to put a pulse oximeter on. And if I get a 92% or greater reading, I know I'm what? I'm oxygenating at the right level, correct?
Okay, okay.
Okay. All right. All right. So I just gave you two. Okay. I hope you're
What
listening.
what week do the baby have enough surfactant?
Oh,
Is that
term babies.
Yes. How many weeks they supposed to?
Term
The
babies, term. Well, what's a term baby?
Less than 37 weeks.
Like 37 weeks and greater. So you have a baby at 37, 38,
Oh, time.
39, 40.
Pre-time is less than 37.
Oh.
Yeah, they should have. Pretermers are ones at risk.
Okay.
You know, pretermers are anywhere from what viability all the way to what 36 and 6.
37, 36, 37.
Yeah. Okay. Is at 37 weeks they turn into term babies.
Okay.
So yeah, pretermer, you know, that's why I hope that you all watched my little video on Griffin. I hope you did watch it. It does show
Yeah.
you a really, really, really good picture of a preemie. Yeah. And how they struggle. All righty. All right. So we that's good. So you'll do good on that one. Hey, give me the signs and symptoms of cold stress.
Remember?
Lethargy,
Lethargy,
Sleep.
yes, very good.
Low temperature.
Low temperature. Yeah.
Body tremors.
Huh?
Is there body tremors too?
Body tremors. I got tachypnea, right? I got tachypnea with periods of apnea. What happens to the skin?
Cool and clammy.
Yeah, there is another term. It's called what? Modeling, M-O-T-T.
yeah, modeling of the skin. Yep.
Yep. Write that down. Write that down. Doesn't that sound like a great all that apply question?
Mhm.
Yeah.
Yeah. You got it. Know it. So you got modeling of the skin. You got lethargy. I have decreased skin temperature. I have tachypnea with periods of apnea. Yeah. And I have bradycardia. Bradycardia. Okay, good. All right. Let's go on. Let me keep myself going here. All righty. Back to the skin. Okay. What are those little white pinpoint pimples on a baby's face? What are they called?
Amelia,
Malaya.
Malaya. Good. Write that down. Milla. Okay, good. So we went over Malaya, we went over Mongolian spots, we went over Vernix. Okay, good. All right. Let's move right on. How about we talk about the GI system? What's the first bowel movement called?
meconium,
Cognac.
Meconium. Yes, meconium. And that has, mixture of amniotic fluid and intestinal secretions and all that kind of stuff. It could have vernix in it. Meconium, it's really thick and tarry looking. Now, if mom is breastfeeding, okay, what color of the stool should she see? What color?
Yellow.
Yellow. Very nice. Write that down. So mom is breastfeeding. The color of the baby stool should be yellow. Good. And when you're charting, you're always looking at the color and the amount and consistency, right?
Yep.
Yeah. And and there's a difference between formula fed babies and breast milk. Okay. Breast milk is nice, is yellow, is maybe a little clumpy, has like little seeds in it. That's what I should say, little seedy, but it's much better and it smells better than a formula fed baby. Okay.
Yep.
And in your book, there's a great picture on the normal infant stool color cycle. A great question would be, if mom is like breastfeeding, what would the nurse expect the color of the stool to be?
So
That's a great question.
Yellow.
All righty. All right. I talked about that. Let me go on here. Okay. So, all right. What time is it now? Let's see. It's about 2:54.
Almost
Why
3
don't you
o'clock.
all take a few minute break? And
Yeah.
let me see if I can get my slides back up again. Okay. All right. Take a break.
Okay.
Okay.
Stay on Zoom. Just turn your camera off if you like.
Okay. Yo, Sharif.
Yeah.
What you doing?
Just arrived at work.
Oh, me? I'm in Delaware now. I'm on my way home.
About to go clocking now.
Oh, so you come back on?